My name is Janice Owen. I'm a family physician and I work as the primary care advisor for the Partnerships for Health initiative here in the Southwest LHIN. I also sit as a member of the board on the Ontario Health Quality Council, which is an arm's length agency that reports to the public on how well the ministry is doing in terms of providing access to health care, and we've been in operation since 2005. The relationship between the Southwest LHIN and the health service providers for this particular initiative, I think, is really one of trying to meet the needs of a chronic disease epidemic that we are seeing not just in this LHIN but across the province. And I think really this speaks to the LHIN's, the Southwest Local Health Integration Network's, interest and desire to try and quell that epidemic that's happening in chronic disease prevention and management. I think it's vital for the patients in the Southwest LHIN because the patients are scattered. We have a very large geographical coverage, and for the patients to be able to work with physicians who are operating in a team-based approach to try and provide chronic care, and also to help these patients learn how to self-manage their own condition when it's really difficult to get to different centers for that care. The outcomes for the project with respect to quality and the patient's experience, I would say that we have seen already with this project patients feeling that they can take more ownership of their particular chronic disease, in this case it's diabetes, and feel more comfortable with being able to manage some of their symptoms better and understand what's happening to them and be able to report quicker to one of their healthcare professionals when things are going wrong. I think there's increased access to care because the patients are now learning that they don't have to react so quickly when there's a problem. They can sort out what the problem is and then book an appointment with their healthcare provider at a time that's both convenient for them and for the healthcare provider, which then means that you're seeing freeing up of the healthcare provider's time when they're not having to deal with emergency crises that patients are having. It's hugely important. I've spoken with a lot of my colleagues who've gone through this particular Partnerships for Health initiative, and they're really finding that their schedule, their time is much more a pace that they can handle. They can plan their days better. They have the help of a lot of the healthcare providers in the community, the pharmacists, the dietitians, social workers, nurses, nurse practitioners, to help them work with these patients so that they can really stick to what they really know how to do well and get an awful lot of help with the other aspects of the patient's condition. Some of the key success factors for making this program work from an integration point of view is what I have seen that's excited me greatly when I see these teams in action is that physicians are really feeling that they are part of a team now, that they have other people that they can work with, either if they're in a family health team or community health center environment, or even out in the community practicing on their own or with one or two other physicians with maybe only one nurse. They're finding out who's in the community that they can work with and to provide a much more comprehensive care package for these patients, and to see the excitement of them being able to read and understand the electronic medical record and how that can help with tracking how well they're doing in caring for the patients with diabetes, and the excitement that they see when they're actually able to say, I didn't know that I wasn't doing as well as I thought I was, but now that I know how to do better, and actually seeing the patient's blood pressures coming down, their blood sugars being better controlled, is really very heartening for them to go through their day and work with these patients, and less of a helpless, hopeless feeling, I think, in that they can move forward and they've got a number of people to help them, including the patient, get there. As a board member of the Ontario Health Quality Council, in our report in 2007, we highlighted the issue around chronic disease management in Ontario and the need for system redesign to happen, and that we should be looking towards a chronic disease management model of using teamwork to provide that kind of care. And since 2007, we've seen in our report, when we've been tracking teamwork, that this, in fact, this notion of teamwork is being picked up in many different ways and in different initiatives like what the Southwest LHIN is doing with Partnerships for Health. And what you're seeing is, in fact, that the patients are actually getting better care. They're being better managed. They're on the right medications. Their blood pressure's down. Their blood sugars are better. They are learning how to take ownership for their health. They're learning how to quit smoking on their own with supports. They're better able to manage their diet. Other than that, this really isn't a very exciting initiative, and I think it's great as a family physician myself to see the excitement of my colleagues when they go through this program, and learn how they can actually improve the quality of the care that they deliver to their patients, which I think is really behind everything that we do.